May I address you throughout the conversation?
Mikla?
All right. So good afternoon. This is Dr. Liza, one of the treating doctor in this clinic, Megla. Nice to meet you again. So I've already seen you a month ago for your Baker cyst behind your knee. Am I right?
Good afternoon, doctor. Yes, I had a Baker cyst on my back of the
Yeah.
knee. You mean
Mm-hmm.
that?
So we decided to observe your cyst for any size change or any new symptoms. So may I know how are you doing so far?
Yes, doctor. I'm concerning about my cyst because I think it's getting large. That's
All
why
right.
I am worried
Mm-hmm.
about that.
Yes, I can totally understand your concern, Migla. If you don't mind, before going to further discussion, would you mind if I ask you a few more questions regarding your cyst?
Sure, doctor.
So, have you noticed any new symptoms like any pain uh, on
No,
that?
no, no. There is no pain or
All right.
swelling, but
Any change with movement? Does it hamper with your movement?
no, I didn't notice any kind of uh,
All right.
problem.
Okay. So, would you mind if I examine your cyst for a second?
Sure, for examination.
Mm-hmm. Okay, Megla. So I've just examined your cyst, and you think that it is getting bigger. Am I right?
Yes, yes, doctor.
Okay, so from your report, I can see that your cyst was 1 centimeter in size before, and I got 1 centimeter now as well. So that indicates that it is still in same size. Do you understand me?
But doctor, I think it getting larger because I don't think so. It on in same size. You know,
Mm-hmm.
I am a dance performer,
Mm-hmm.
so
Yeah.
I'm worried about my performance. So please give me some medicine or anything else that will uh, give me remove some anxiety. Please, doctor, give me some medicine.
All right. I totally respect your concern, Megla, regarding the size change. So for now, as I get the size is still same. So I'm so sorry, but I want to observe your cyst for another 3 months. Um, is that okay with you?
Doctor, you know that I have a busy schedule in
Yeah.
coming days, and I
Yes.
want to be sure that cyst won't grow anymore. And you know,
Mm-hmm.
I followed every instruction that you gave me there before checkup. It like physio, eyes support, footwear, so on. And I'm still worried about now.
I'm extremely sorry, Megla, that didn't help you. But I would strongly recommend you. You are already proactive regarding the treatment procedure, and I would strongly recommend you to continue the physiotherapy and ice pack compression and the supportive footwear I've prescribed you before, and also I just wanna observe you for another 3 months for any possible enlargement and any possible new symptom, as you mentioned that there is no new symptoms associated with your cyst at this moment. For the further treatment option, we can discuss about it. You can simply review with a sports physician if that's convenient for you. And if that's not help, then you can make appointment with the orthopedic surgeon, and they can rule out your problem in further. And also you can visit the knee arthroscopy. You can, or you can do possibly they can suggest you possibly a knee arthroscopy to evaluate or treat any underlying injury or degenerative change. Is everything understandable to you?
I understood, but doctor, if you don't mind, I want to know that if any surgery, to remove any my cyst, if it is possible, doctor.
Yes, thank you for asking me that. Yes, I've just mentioned about the knee arthroscopy, which is a surgery to evaluate or treat any underlying injury. If you have any underlying injury related to this cyst, that's the option. Are you okay with that?
Okay, doctor. Yeah,
So
understood.
yeah, for now, if you want, I want to suggest you to make another review visit with me in 3 months. Other than that, you can also make appointment with orthopedic surgeon. So it's totally up to you for now, but I will recommend you to wait for another 3 months to any possible symptoms change or any size change.
Okay, doctor. I am agreeing with you, and I will follow your instruction, doctor.
Thank
I
you for
will.
agreeing with me. Yeah, so I'll make an appointment again in 3 months. Yeah, and see you then. Wish you a healthy life.
Okay, doctor. Thank you. তিন মিনিট কি শেষ?